Today's World Insight, the WHO without the U.S., what it means for global health efforts amid a pandemic, a matter of life and death, and hundreds of thousands of foreign students in the U.S. in danger of deportation to the U.S. visa policy on online courses. What's next for international higher education? Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you from Beijing. I'm Tian Wei. The Trump administration sent a letter giving the United Nations a one-year notice before the U.S. leaves the World Health Organization. The U.S. Congress received a formal notification of the decision on Tuesday, more than a month after President Trump announced his intention to end the U.S. relationship with the WHO. The White House said the withdrawal would take effect on July the 6th, 2021. But what does a U.S. exit from the WHO mean for the COVID-19 pandemic and global health efforts? Could leaving the agency cost more lives inside the United States? Is the withdrawal plan a scapegoat for U.S. failure to put a lid on the coronavirus? Let's ask our panelists. In Providence, we have Dr. Megan Ranney, an emergency physician of Lifespan Brown University, and also in Washington, D.C., Joe Rubin, former Deputy Assistant U.S. Secretary of State. Welcome to both of you. Want to start by asking about your immediate response toward the formal apply for withdrawing from the WHO by the current administration. Dr. Ranney.
So we are in the midst of an international pandemic right now, and one of the key helps in fighting pandemics is the WHO. Withdrawing from the WHO right now seems poorly considered and detrimental to the health of our country and to the health of the world. The one thing that gives me hope is that this withdrawal will not be complete for another 6 months, so it gives us time to reconsider.
Interesting you talk about the timeline. Mr. Rubin, is this more an election political trick or real withdrawal by the U.S. from the WHO? Should it be a joke that can be played this way or that way all the time?
Well, it certainly sounds like the Trump administration will have it both ways, where they can claim that they're taking a tough action on the WHO, but not really do anything about it and punt it to the next year and possibly the next administration. I think it's a very disingenuous move, though. This administration is not giving us a plan for how to, as my colleague said, deal with the pandemic on a global level. It's a global crisis. It requires a global solution. So this position just puts further pressure on the international health community, and it doesn't really do anything to resolve the issues at hand. There are concerns about the WHO. This is nothing new. But the approach that President Trump's taking is clearly politically motivated and not one that's going to get us solutions.
We've been hearing from the candidate of the other party suggesting once he is in power into the office, he's going to reverse the decision. Now, it's interesting that the public health issue has become a campaign issue, has become such a partisan issue, has become an issue that the world have to wait until the U.S. election comes to an end. We have millions of lives on the line. So, Dr. Ranney, your response?
So I am concerned about withdrawing out of the WHO for numerous reasons. Certainly our response to COVID-19, but also the degree to which the WHO coordinates so many other public health campaigns of international importance against polio, against malaria, against Ebola. Withdrawing will hurt the U.S. as well as other countries. I agree completely that public health should not be a partisan issue. Unfortunately, right now in the United States, respect for evidence and for science has become divisive. Whether we're talking about vaccines or whether we're talking about mask wearing, there is a portion of America that is fighting against the evidence base. Those of us in public health and medicine are happy to appear on news shows like yours on an almost daily basis to try to change that communication. And when we do surveys of Americans, the vast majority of Americans agree with taking these evidence-based health protecting actions. My hope is that we can get the government to join in understanding that health is not a political issue, and that unfortunately viruses don't follow politicians. There are natural rules of science that these viruses will continue to follow whether or not we are part of the WHO.
Mr. Rubin, of course, you've been in politics and in different administrations. What about now? It has become a political campaign issue. From now until the campaign comes to an end, the election, about public health, what can we hold on to, rather?
So my fear is that we have now seen the Trump administration politicize public health to such a degree that the American people are getting sicker as a result. We're seeing this even today in the debate between different Republican-led states in this country who are seeing surging cases of coronavirus in their states, having different views on whether or not to wear masks, which is an incredibly basic protection for preventing the spread of the disease. So the politicization of public health is deeply concerning. And I have to say on the China issue regarding the politics, what we're watching is the culmination of President Trump's America First ideology, which is one that essentially pushes away cooperation with the international community at every level of government. And Joe Biden is very different in that regard. But the country doesn't want to see us self-isolate right now, because self-isolating is making us sicker. And it's also not even practical. If one looks at the potential for a vaccine, for example, we're going to need international cooperation and coordination. We are cutting off our mechanisms right now if we leave the WHO. So President Trump is making a lot of political calls. His party's making a lot of political calls about public health, and it's making Americans sicker.
Talking about the pandemic and the U.S. right now, let's take a look at some of the numbers. Coronavirus cases spiked in the U.S. though recently. They have gone down in the other parts of the world, including China and the European Union countries, for example. The withdrawal comes as coronavirus cases in the U.S. topped 3 million, with more than 130,000 deaths already, according to Johns Hopkins University data. And of course, the data is only, some suggest, a part of the real situation. Worldwide, there are more than 11.5 million cases and almost 540,000 deaths. I know we have to breathe deeply when we hear these numbers, but these numbers are the realities, ladies and gentlemen, we have to face right now. So, Dr. Rani, we see right now the politicians are calling on the opening of the schools. Well, one argument is that the schools need to be smart and try to incorporate these situations, bringing knowledge and information to the kids and to the students. But the other part of the debate is when the school is open, when there's no guarantee of health and security, how should the students be able to survive all of this? So tell us more about your thoughts.
Yeah, this is an area of huge debate right now in the United States. I actually wrote a long tweet thread about this on Sunday. The science is still new, which makes it difficult for us to give adequate guidance to schools on how best to keep students and teachers and other school workers safe. There is really good evidence that keeping kids out of school hurts kids. It hurts their education, it hurts their social and emotional learning, and for the kids in the United States who depend on schools for a safe place to go, for a warm meal, it hurts them more. The trouble is, of course, that we do worry also about COVID transmission in schools. The biggest determinant of whether we can go back to schools or not is going to be two things. The first is if we can keep the rate of COVID-19 down in a community, if we can keep it at a low level, then it's most likely going to be safe to send kids back to school if they and teachers are wearing masks, if they're in stable groups, and if there's a little bit of extra space between the kids. However, if those rates of COVID-19 go up, we can't send kids back to school because the teachers and the kids are both going to be bringing it in and spreading it. The other big thing is funding. Public schools in the United States are so underfunded, and asking them to take on providing protective equipment for school nurses and teachers and students, and creating the extra space that's needed to keep kids and teachers safe, that's expensive.
Yeah.
And schools are already facing cut budgets across the United States. So we're really stuck in this very difficult situation where there's no perfect answer. We're weighing one bad thing against another.
Yeah.
What's needed is, again, a good public health response and a little extra funding for us to be able to get kids back.
Dr. Rani, I can see your passion and also the care you give in your answer about the latest situation. But school opening or not, to what extent is only one of those big debates going on in your country, talking about its relations with the pandemic. Mr. Rubin, there are other questions. If you look at the latest numbers in 32 states, the rates of infection are still going up. That is according to the latest number. And according to Dr. Anthony Fauci, which is in the United States quite a respectable figure in terms of public health, he's saying, quote, "We are still knee-deep in the pandemic." So what does this all mean? And with this situation, how should the U.S. think about its relations with the international mechanisms such as World Health Organization, with cooperations with the other countries? These are important questions that need to be thought about immediately.
Yeah, there are a couple of levels here to your question. I appreciate the way you're describing it, because there is an international level of cooperation that's necessary. But there's also one domestically here that we need to get our house in order, and we have clearly failed. Our government at the national level has provided no hard leadership to the states on how to prevent this new surge that we now are experiencing. In fact, the president encouraged people to leave their homes prematurely when mechanisms were not in place to trace their contacts, to test people, to keep appropriate social distancing, and all the rest of the tools that we as individuals have to prevent the spread. So we're now in this dire circumstance, and it is at a national level failure. And going to the question of schools reopening, we can't have it piecemeal everywhere. We need to have consistent rules and consistent guidance so that there isn't a hotspot in one part of a state and then a less hotspot in another. It'll just spread everywhere, and everywhere gets hot. And on the international level, it's the same dynamic, where the United States now, we're paradoxically, as an America First country, we're America alone. We are self-isolated. We are banned by the European Union to travel there. The citizens are going to be quarantined for 2 weeks around the world in multiple countries that have gotten this under control. This is bad for American business. This is bad for American leadership, certainly at that level. But at the end of the day, it's bad for the American people and our health and our ability to function.
I see.
And so we need international cooperation, but we will get that when we get our own house in order. And right now, our house is in disarray.
Well, it's certainly a right argument, but on the other hand, you probably have to do both at the same time, isn't it? Because time is really precious in terms of infectious disease. But it's up to the U.S., of course, to decide. However, I do want to ask a medical question to you, Dr. Rani, because now if you look at the death rate, 150,000 in the United States, some suggest the rate of death has been going down, and therefore the virus is not as dangerous as it used to be, and therefore why should we care that much? And there's also argument as to, who are actually dying. Probably those old people that are dying, and therefore should we care that much? We have heard some of the even doctors and professionals, health professionals, argue that way, for example, on Fox News network. So how should we understand these kinds of twists and turns in the arguments?
So there's a few different parts of this. So the seemingly decreasing death rate is actually a fallacy. Hospitalizations are currently going up. So first you see increasing infections, then you see increasing hospitalizations, then you start to see increases in death rates. They're spaced apart by about 2 to 3 weeks each, and we're starting to see that trend. So remember, we started to see the reports of increasing infections in Texas, Arizona, and Florida a little over 2 weeks ago. Our hospitals and our intensive care units there are now filling up, and we are starting to see spikes in deaths in those states. My expectation and that of the rest of the medical community, sadly, is that we are going to see similar spikes in death rates to what we saw in New York City over the next couple of weeks. Now, the people that are getting infected in the South right now are generally younger, who are less likely to die than older folks. And we, of course, do have somewhat better medical treatment, although not perfect by any means. We don't have any life-saving measures at this point. So there may be a slightly lower death rate than we saw in New York, but we are still going to see astronomical rates of death over the next few weeks across the South. And I don't want anyone to think that just because we haven't seen it yet, that it is not coming. It is coming. The other part about the elderly, Sweden tried to keep its economy open and just have the elderly stay at home, and we saw what happened there. Their death rates are higher than in the rest of Scandinavia, the rest of the Scandinavian countries, and their economy was just as hurt. So saying that we can just ignore the health of the elderly or tell the elderly to self-isolate is not going to work, and we have international evidence to that effect. So I don't want people to be assuaged or pretend that this virus is somehow safer. It isn't. And we're getting accumulating evidence both from our own country as well as internationally of the degree to which, once again, that public health approach is so critical, because we can talk all we want, but the virus works the way it wants to. And we have to respect that if we are going to stop illness and death.
Another question, I also have to tap into your expertise, Dr. Rani, is some of the public health officials in your country have been suggesting in one way or the other that the public might interpret as if the U.S. have a much better understanding of the virus, and it's very likely therapeutic treatment and vaccines are right on the horizon to save lives, so that the economy can be open, everything can be open, as if there's nothing is really happening. So is that the reality, or is that a mirage, according to your knowledge?
Yeah, so we certainly have somewhat better treatments than we had early on. There are some things that we've changed about the way that we take care of the really sick patients in the emergency department and the intensive care unit, but we still don't know how to stop people from getting really sick. There are a lot of trials going on, some of which are very promising, but as a scientist myself, until that study is done, until we've seen the results, I am not going to hang my hat on whether or not it's going to work. There are some promising studies about antibodies, some of the vaccine trials look good, but it is too early to count on them. Now, we all want hope. So I, myself, am very much hoping that at least one of these vaccine trials is going to proceed well, that it's going to keep hitting its milestones, it's going to keep showing safety, and that by early 2021 we will have a vaccine that will be available for some portion of the American public. But it's not going to be available for everyone, and that's in a best case scenario. So yes, we should look forward, we should have hope, but that shouldn't stop us from doing what we need to do today to keep ourselves safe.
Mr. Rubin, I remember very well one of the political arguments in earlier election cycle is that whether hope is the strategy. I think that's very relevant today in a public health emergency, whether hope is a strategy or the strategy should be something else. Mr. Rubin, you're not a professional in medical science, but from your perspective as an American citizen, as someone in the public office, what do you make of that?
Well, I am a father of 3 young children, and we have been grappling with this coronavirus and its impact on our daily lives. And the last thing I want to hear from our elected leaders is magical fantasy policy recommendations. There is absolutely nothing in what the president and his team are saying that gives me confidence that they actually have a plan and a strategy for how to keep us safe. We should be listening to the scientists and the doctors, our medical experts, our officials in this field. They are the ones who should be guiding the policy response. And when I served in the Obama administration, that's what we did when the Ebola crisis happened. And there was an outbreak in Africa, and there was a question about how to deal with it. Would it come here? What role do we have as a government? And we deferred to people like Dr. Fauci and the medical experts, and worked internationally with the bodies like the WHO, who had the lead on engaging directly on the ground, and we sent assistance out. That's the way to do things. Right now we have a dynamic where the president is for a long time has been providing false remedies be it using Clorox in one's body, be it taking hydroxychloroquine, to now not even speaking to the American public and saying people just need to go out and forget about this as if it's not real. Well, Americans are smarter than that.
Okay.
We know that this is not the solution, and no strategy means no leadership. And I think there's a consensus in the political community here that President Trump just doesn't care at this point. He wants to move on because he thinks it hurts his ability to get reelected, which is incredibly dangerous.
As you may know, our discussion here, from my perspective, is not about intruding into your internal politics about who should win the election and who have a better say in the politics in your country, but rather a discussion about the pandemic and the United States, which will have a huge impact on the rest of the world. After all, it's a public health issue. The virus does not respect borders. Having said that, though, let's move on about, what kind of international cooperation we could have. Before that, let's take a look at some of these things. After President Trump announced the U.S. withdrawal from the WHO, U.S. officials continue to press the WHO and its Director General to commit to at least some of the changes the president demanded, with a chance the U.S. president would reverse course if it did. But he has been reluctant to do so. In an opinion piece in the Washington Post, WHO chief cited the agency's leading role in the fight against the smallpox and polio over the decades, as well as other diseases such as Ebola, Zika, and measles. So now the organization is heavily involved in efforts to contain the coronavirus as well, especially in poor countries where it's spreading rapidly. So it really puts us to a discussion about the role of the WHO and what should be nation-states relations with WHO and how international cooperation should take place. Dr. Rani, you've been nodding your head. I know it's crucial to your work, even for frontline doctors. Tell me more about that.
So there's a few parts to why WHO and that international cooperation is so critical. The first is, as we saw with COVID-19, viruses and new diseases can emerge all over the world. And by having a World Health Organization, we can detect those and create responses to those more quickly. The second is that we as Americans do not go into every country, and there are parts of the world where the WHO is the primary health respondent. When you look at Ebola and what's going on in the Democratic Republic of Congo, we need WHO to be there to help fight it so it doesn't spread. The third thing is, as we've already talked about, the viruses don't respect boundaries. Listen, I am in a major urban center. We, not right now because of travel restrictions, but normally get people all the time who get off a plane from another country and come into my emergency department. They have the potential to bring diseases with them, and we need to be able to coordinate with other countries in order to identify and stop that spread. The last thing is efficiency. It's silly to have us working on public health problems that have the same effect worldwide in 60 or 180 different ways. We're going to be more efficient, we're going to save more money, and we're going to be more effective if we coordinate together to do drug trials, vaccine trials, and to put out those public health measures that are so effective in stopping the spread of disease.
Dr. Rani, if I just follow up, you said that you're going to save money, quote unquote. Well, money is also a matter, isn't it? I mean, now the United States owning the membership of WHO to the International Health Organization, $190 million over the years. So if that money is putting into the United States for the fight against the pandemic, do you think there'll be enough for vaccines, therapeutic treatment, public health issues, all the guidances and everything? And you don't need to take care of WHO, don't need to work with them?
It's absolutely insufficient for the public health work that we need to do here in the United States. And that's a huge amount of money, but compared to the overall U.S. government budget, that is not a huge amount of money. And its effect within the WHO is large. If we're really concerned about the way that WHO is spending the money, we should take an active role within the WHO to insist on accountability and make sure money is spent well. That money alone is not going to transform our approach here in the U.S. As my colleague has already said, the issue is one of creating clear strategy and guidance, just as much, if not more, than it is one of money. I mean, heck, we just bought all the supply of remdesivir and invested a huge amount into buying a theoretical vaccine that may be made. We have the money to invest in public health strategies already in the United States. It's a question of leadership and will and strategy.
Well, remdesivir, whether that should be wholly purchased by the United States, while the other countries are also waiting for the therapeutic treatment, is another debate. We'll leave it for another time. But having said that, though, Mr. Rubin, from the public policies perspective, what is the point of working with the international organizations from the U.S. perspective? And when you were working in administrations, how much do you think these kind of international platforms would be able to support even your country, the largest economy in the world, to deal with some of the issues worldwide?
So we have been, for years now in the U.S., in a debate about the role of international organizations and how we should be engaging them. This has been a political fight between conservatives and liberals and different kinds of factions, but ultimately these are just platforms, and these are platforms that can enable us as a country to engage the rest of the world. We can't blame the platform itself if we don't like how the world is reacting, and there are serious problems, and I'll say it here as well with China and Chinese behavior at the WHO. But that doesn't mean that we stop engaging and walk away. That means we lean in and we talk to China about the issues that we're concerned about, that we talk to our allies, that we engage aggressively. And there's a real ideological split in many ways between engagement and disengagement. And I think we see the results, as the doctor is saying. Disengagement has such significant negative repercussions on so many levels of, in this case, global health. How are we going to fight malaria? How are we going to support the fight against AIDS throughout the world? What are we going to do to get our message out around the world on global health issues that are global in nature? We are not an isolated country. We need to find cooperation. So it's not easy. International organizations are not simple creatures. The United States doesn't get to be the only voice, but I think that our policymakers need to be able to engage and deal with the hard conversations rather than walk away and think that somehow that improves the actual outcomes for our citizens.
See, to talk about China, I'll only be fair if I quote the Foreign Ministry spokesperson talking about the U.S. departure from the World Health Organization, quote, undermines the international anti-epidemic efforts and in particular has a serious negative impact on developing countries in urgent need of international support. There are a lot of issues that you mentioned, both of you, that really needs a lot of discussions in different programs we're going to have in the future. But for now, I really want to express my appreciation for your participation, and be well, really.